Hello, everybody. Welcome back to the PTC podcast. I'm here today with Gemma McFall. How you doing, Gemma?
I'm good, thank you. Thanks for having me.
No worries. Thanks for coming down. I know traffic around here is a bit chaotic today. So we'll go straight into it. You're a pain coach, helping people reprogram their pain psychologically through, how did you put it a few minutes ago? Understanding their personality types and their previous traumas?
Yeah. I use pain reprocessing therapy, which covers those things. Yeah.
Okay, so what does that involve? Someone like, what kind of people do you see? What's the common kind of pain reporting?
The common type of people I see are the ones who feel like they've tried everything. They've been bounced around here, there, and everywhere, and then they're not getting lasting results. You know, they'll see an osteopath or a physio, and the symptoms keep coming back. So that would be my ideal client that I work with. And pain reprocessing therapy, it's in a nutshell, it's turning down that pain signal in their brain.
And how do you do that? Like, what's the process?
So there's three different areas we look at. One is the past, understanding past traumas and how that's impacting them today. Personality traits, where maybe self-induced pressure is causing actual physical pain, and then practical techniques, things that they can do in the moment when the pain comes.
Okay, so let's start at the top then. How, like, someone sits down with you Gemma, I've tried everything, like, because I get similar thing in the movement, in the fitness world. People come to me, they've tried quite a lot of things, and usually for me it's very simple. We can pretty much in the consultation discover that one of the things they've not tried is strengthening. But because they're in pain, they can't really do a lot of exercise. So how do we work around that? And then just through different movements and different whatever, we can figure out a way to free their body up, reduce the pain, i.e. the pain signaling, and then start to improve that tissue capacity, whether it's strength, whether it's balance, whether it's coordination, communication, whatever, all that. And then hopefully increase their capacity to a point where they're now strong enough to not get fatigued. Fatigue doesn't then trigger that kind of sympathetic response physically, and then they come out of pain. That's kind of it in a nutshell. But how does your system work?
Okay. So I'm not at all physical. Everything I do is mostly on Zoom. The thing that I'm working on with clients is the fear around movement, and teaching them, or like helping them to see that what they see on the MRI scan is most likely not what's actually causing the symptoms. And I do that using just educating them on the latest science and the research. We know it's normal to have an abnormal MRI scan, but most people that come to me believe that what they see on the MRI scan is 100% what's causing the pain. So just helping change that belief is a huge step forward in getting rid of the fear. And I would say that's the first part. But then it's fear around their own brain, their own, like the overthinking, the perfectionist, the people pleaser, all of these personality traits that cause the brain to be on high alert. That's fear, and the fear triggers the pain signal in the brain.
So are you putting them through a personality test, or are you just sort of connecting dots and broadly categorizing somebody as, I don't know if this is the right word, you can correct me if I'm using someone who's quite neurotic or someone who's chronically stressed, or do you have a structure, like a pattern that you take people through? Yeah,
so I put people through Gallup Strengths, which is a personality tool. It's a very comprehensive tool, and it gives you your natural strengths in order. I focus only on the top 5 to help them see how their specific personality is contributing to the self-induced pressure and stress that they're putting on themselves, and help them to see why maybe certain parts of their personality is causing them to be a perfectionist or an overthinker. Because it's very easy just to say, oh, I'm an overthinker. But when you understand why you're an overthinker, you can then move some way towards changing that.
So what if someone's an overthinker? Like, how does that lead to pain in their physical back, for want of a better way to put it?
That's a great question. I will give you my own personal example. So I had back pain for 10 years, and I am a big overthinker. And what I used to do, I had drawn a grid of my lower back with 6 squares. And I'd wake up in the morning and I would mark on that grid where the pain was. And then as the day went on, I would move a little dot and all little timestamps, proving to myself that the pain is here and then it's there and then it's... And this was like obsessive overthinking, because I was hoping that when I had this data and this chart that I'd created, I could give it to a surgeon and say, look, it is physical. But what I'm doing in this process, the minute I'm waking up, I'm straight away focusing on the pain, which is then putting me in high alert, which is causing more fear, which causes more pain. So the first thing I needed to do was get rid of that checklist.
So I'm just going to dig in on, when you say you were an overthinker, like what does that mean? Because some people think they're overthinkers, some people think they have OCD, when really they just like things to be neat and tidy, whereas OCD is something clinical and like dark obsessive thoughts, not just like, oh, I like my numbers to be even and I like my placemats to be symmetrical with my knife and my fork. Like that's not OCD.
Yeah.
So what would you class as an overthinker? What kind of overthinker were you?
So if once you've got the results of your assessment, you can understand why you're an overthinker. So for me, I have a strength called achiever, which means I have to achieve something, like always. And when I'm achieving something, I feel great. When I'm not achieving something, it's like I'm half the person. So for me, this obsessive checklist on my back, trying to figure it all out, that was my achiever in overdrive. For somebody else that's got, let's say, analytical as a strength, people with analytical, they lead with questions. So they would be questioning, why is this like that? They would be asking the surgeon, they would be asking Google, they would be constantly asking questions. And again, too many questions keeps you in that tense mode. And someone who has analytical, who doesn't get answers to those questions, it's going to be triggered. And if I give you one more example, I also have futuristic, which means on a good day I'm an overthinker, as in like I love thinking about the future. I'm a dreamer. I live for tomorrow always. On a bad day, when I've got chronic pain, or at the time my futuristic was being used in an awful way, I could only imagine a future in a wheelchair. I had no happy future at all. So like this natural strength of futuristic was working against me in a big way. Yeah.
So does that then lead it? Are you just talking about general anxiety about the future, or are you talking about like something much more sinister?
Honestly, I wouldn't say it was anxiety. At the time, I didn't feel like I had anxiety, but my brain was obsessed with trying to fix it because of the achiever and imagining this future. But I was almost imagining it like I was being proactive. I was Googling like how to look after children when I'm in a wheelchair, like this and I thought that I was doing the right thing and being proactive. But obviously now I can see, looking back, that every time I even allowed myself to have that negative future thought, it was putting me in a state of fight or flight, basically, on a miniature scale, but like all day, every day.
Yeah.
And so that is self-perpetuating, keeps the pain cycle going. The more pain, the more fear, the more pain.
Yeah, the more fight or flight. I keep using these words because anybody who listens to me, I would love them to be able to click one day. That's just that sympathetic nervous system response: fight, flight, tense, wound up, anxious, all the negative, all the stuff you don't want to be feeling. So what do you think led you to be such a obsessive, maybe I won't use the word obsessive, such a strong achiever? Like what's that? Because I imagine a lot of this will come back to people's past. So what is it from your growing up that led you into this lane where you wanted to be an achiever, and then when it wasn't going right, you predicted the negative?
Yeah. I'm not sure if personality is always because of past. I think I mean, at least through the Gallup training that I went through and on this tool, we are all born with all personality traits. And then very quickly, the synapses in our brain start to fall away, leaving us with who we are meant to be. And then over time, we use those strengths again and again, and then we get better and better at them. So for example, with me and this, I give you another one that I have is discipline. So if I see chaos, I have to organize it. Like if there's no system, I have to put a system in place, like even on a miniature scale. So as a child, I would organize the books in my room in height order, and then the week later I would do it in color order, and had a super organized bedroom. And that served me as a child. But then as an adult living in a house with 2 kids and a husband, if something is out of order, again, it's a trigger for me, because they're not following my amazing system of whatever it is.
Yeah.
But every personality in the Strengths Finder is good, but it also has a flip side. And so with the clients I'm working with, it's the flip side that we're looking at and seeing how it's tripping them up, causing more tension in the body. But then also how can they use those same exact personality traits to find joy and happiness and go back to the gym and do all the things that they should be doing.
So what are the strengths, or what are the personality types you said? You've got discipline, achiever. What are the other ones that are on that list?
There's 34, but I can tell you the ones that people with chronic pain tend to have the most. Harmony, people who hate conflict, they hate rocking the boat. But I say it's a strength, and now it sounds like I'm saying it's a negative, but actually if you've got harmony, it means you are really, really good at seeing what everyone has in, like in a meeting, everyone's arguing. With harmony, you would be able to see what everyone has in common, and you could be the one that helps to solve that problem. But the flip side is it feels a little uncomfortable, so you hide under the table. So harmony is a big one. Empathy, people that have strong empathy, it's a super, super strength, because you can read how people are feeling. You can help others put words to their feelings. But of course, from a chronic pain point of view, the downside is that you tend to potentially absorb other people's feelings as you go throughout the day. And then it gets to the evening and you're trying to sleep with everyone else's emotions and
Interesting,
everything. One that I see come up a lot is strategic. It's really interesting when I work with someone with strategic, because strategic means they are really, really quick thinkers. And they can, someone will present a problem, and within a second they know the answer. Like their brain just is that fast. But their biggest frustration comes from the fact that the rest of the room, it takes them ages to get there. And so they often say things like, oh, I work with idiots, But of course they don't work with idiots. It's that they have strategic. So they are really fast thinkers, and other people have other strengths, like maybe they're super creative or whatever. So even just helping them see, that frustration at work, it's because of your superpower, not because of other people. Does that make sense?
Yeah, no, look, when you're saying these things, for me, it all just sits on the same spectrum of if you're a fast analytic, what did you fast thinker? What did you describe it as?
Fast thinker, fast doer, competitive.
Strategic, you said.
Strategic.
Yeah, so strategic. Then, if you play it out as your example was, you're getting frustrated with people in the room, they're not up to speed. It's slowing you down. Therefore, it's kicking in a level of impatience. Impatience is in that negative spiral on that sympathetic end. It's okay every now and again, but if you're chronically impatient, then there's something more anxious, more wound up in your nervous system, and then you're going to be in that sympathetic kind of brain state, and then you're going to be more sensitive to signals from your body, and then the brain is going to receive that signal from your knee or from your back, and the brain is already in a more sensitive state, so it's going to amplify that, crossing the threshold into your perception, and you're going to start feeling pain either in your back or your knee or whatever it is. So
100%.
Look, I totally see the merit in all of this, and this is what I want to try and kind of dig into it, and because a lot of people, they won't they don't understand that pain is like, it is in the brain, it is in the nervous system, and it depends on more than just the health of your tissue. It's not always relative to what is the tissue state in, because the tissue is the mechanical aspect of the body. The pain has to jump from the mechanical aspect into the cable network, which is the neural network, travel to the brain. The brain has to receive that information the same way it receives the information about temperature in the room, about pressure on your skin, about what else have we got? What are the skin sensors? Pressure, pain. Anyway, if you're cold, your body your brain will receive the info after the temperature's already changed. So you're in this nice little zone of temperature where it's fluctuating, but when it gets too cold, then you feel it. The brain goes, you know what, this is a little bit cold, I'm going to put a jacket on, because ultimately I don't want this. If I get too cold, so I kind of go, if this, then this. If I get too cold, then I'm facing danger. So I'm going to correct this, I'm going to cause a stimulus. Body reacts, you put a jacket on or whatever. With the pain, the same information is being fed to your brain. So as we're sitting here now, and probably people listening to this, your brain is being fed information from your system in milliseconds about what's going on. Temperature is one, like you said. As you're looking around, vision is another, noise is another. There's loads of these things that in your subconscious you're assessing the world around you to see what's a potential threat and what's not. So if you have an area of your brain, because the left side of the brain is responsible for your right knee, let's say. So it's a little bit of, you got knee pain in the past, you've back pain in the past, you've some sort of chronic stimulus where in the past you've had these pain patterns. Now that little bit of brain on the left hand side that's looking after your knee, that's going to be on slightly higher alert in general. The same way, and kind of to put it in a strange example, if you walk down a street for the first time and you get to a corner and out of nowhere a lion or a wild animal jumps at you and it's in a cage, right? You're going to get a fright. Geez, what is that? It's in a cage, no threat, but the first time experiencing this, you don't know what the parameters around this threat are. Boom, there's a cage there, there's no threat. You stand on the footpath, you look at it and you go, wow, there's a lion in the cage. The next day you go, there's a lion in the cage. You walk down to the corner, the lion jumps at the edge of the cage, no reaction. You're not threatened by this because you understand exactly what's happening. It's the same threat, the lion jumped forward, but the second time you have a predictive mechanism installed where you know it's safe, right? So going back to the knee pain, in the past you have this knee pain sending info to the brain. Now the brain is on higher alert, knowing that if we move this knee, it might potentially cause us damage. So you move the knee 100 times a day, it doesn't cause you any pain. But then out of nowhere, you get in and out of the car, you're going up and down steps, the knee starts to hurt, right? But we've already moved it a bunch of times this day, it's not really caused any problem. So what's after happening? Well, this is going back to the sympathetic, and this is going back to what you're talking, I'll link in what you're talking about in a few minutes when I eventually stop rambling, but your brain state gets more stressed. Cognitive, whatever, emails, finance, all those big bubble like stressors, the generic ones that people know about. So the whole brain goes from a 5 to a 6, but the area of your knee was already at a 6 because of its past history. So the area, the little bit of real estate that's responsible for your knee that's in your brain, that goes from a 6, it was at a 6, your body is at 5, that's going to go to a 7, your body's gone to a 6. Let's say something else happens, there's another daily stress, you're hungry now, you're dehydrated, you're not slept, your kids are making noise, whatever, traffic is whatever. You get out of the car, your body goes from a 6 to a 7, the knee goes from a 7 to an 8. Now, on my arbitrary pain scale, now that 8 crosses over into perception and you feel your knee. So nothing has happened to the structure of your knee. What's happened is your cognitive stress has gone up, your psychological stress has gone up, your brain has changed its brain state, and now the knee has crossed the threshold. So now you're feeling pain because the brain creates the pain. The brain receives the info from the knee and it decides. So while you think you're feeling pain in your knee, you're really feeling it in the tiny little bit of real estate in your brain, because that's where we see everything. You're seeing in your brain, even you're hearing in your brain, even though the input is coming in through your different organs. It's actually being processed in the brain. Same with the physical. So that's kind of where I take people to in my conversations. And then I'm saying to them, right, what we're going to do is we're going to down-regulate that original 6 in the knee to a 5.5 or a 5 1/4, whatever. so that as you get more stressed, it doesn't breach that 8 pretty quickly. The second thing we're going to affect in the gym is we're going to make everything stronger, right? And it's a very simple principle, but really what you're doing it's not just you're making it stronger so it can do more work. You're making it stronger so you push away fatigue across time. You delay the onset of fatigue. Fatigue is one of the things that's stress. When you're tired, you are more sympathetic. So if we can push that fatigue away further in time, you're going to feel less tired. The knee is going to be able to do more work. Therefore, it's not going to dip into this sympathetic pain kind of spectrum area, whatever. So that's the second thing. And then the third thing that gets stacked on top of that is repetition, this predictive mechanism. If we can keep gymming without going crazy and wild, you begin to imprint this new system of, wow, this knee is actually fine. And you say that over and over again. Every time your subconscious senses your knee moving, this knee is fine, this knee is fine, this knee is fine, this knee is fine. Subconsciously, your brain, your proprioceptors, all that is talking to your brain. And then it turns that 5.5 down to a 5 as well. And you create this new neuroplasticity. Your brain gets a new map of the knee. There may be if this was on an actual scale of measuring, there may be a morsel or an element of still predictive in the future where if you're going to get pain, it's going to be your right knee, not your left knee. But by that stage, if you've listened to me enough, you should be able to understand it and know that, oh, this knee is sore, not because I need to go to the physio and get a scan because the structure is damaged. It's sore because I've been walking around the mall all day, can't find the thing I want, I haven't eaten all day, I haven't drank any water today, I'm so dehydrated, and tomorrow I've got a big presentation at work that I need to be going home to prepare for, blah, 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 blah. So, at that point, I'm focusing on the moving with people. So we're just going to do those 1, 2, 3 things I just mentioned. But for you, you're talking about tapping into why is their brain stressed?
Yes.
What is it about this is taking it back to the strategic, taking it back to the impatience. Why are you so impatient? Why are you letting these thoughts run away with you? So why are you letting your 5 go to a 6, your 6 go to a 7, your 7 go to an 8? What personality traits can we control that you have that are driving that brain state into that sympathetic response, so that in my world, the physical movement is causing the trigger, whereas in your world, you're calming that pushing effect of, you're calming the system that's driving people sympathetic. So, and just saying, look, your knee is going to be more sensitive, but my domain is the psychological. So I'm with you on all of this. I get what you're doing. You're doing it from a completely different perspective. But I just think it's one of those things that people don't understand. They think pain is structural.
Yeah, and it's interesting listening to your story about was it a lion on the corner?
Yeah.
So it's
probably not a good example, but it's...
Well, I give you the example that I see it come up often. So let's say a guy will come to me and they'll say, I had a football injury in my 20s, and I'm now seeing them as a 40-year-old with this football injury, but it's like you said, the knee is still the same knee as it should have healed. It did heal.
Yeah.
In the 20s, it did heal. They saw the physio, they did the strength training, they fixed it. And now in their 40s, they're telling me, oh, it's just come back for no reason. Oh, I did this little small thing and it's triggered and it's come back. But then when you look at what's happened for this particular client between when he was 20 and 40, he's now got a family. He's an expatriate living abroad. Everything is on him, the visa, the medical, the house, the schooling. Like, if he loses his job, the whole family have to go home. He's got a wife that's probably got the opposite personality traits to him, so which is great. It's great to marry your opposite, but one of the things I did with him was help him to see that your wife's not being awkward difficult on purpose. She is just not you. Like, you can spend the rest of your life trying to make her be more strategic like you, more of an achiever, more of whatever, but then she won't be her anymore. And just in that simple thing, it's like, oh yeah, like I married her because she's got all these things I don't have, right? It's time to stop trying to change her and just, whew. And then on top of that, there's kids that wake you up at a time that is before your body wants to wake up, or they'll wake you up in the middle of the night, and so these are like what we call the years of responsibility. And most chronic pain people are in those years of responsibility, but the knee is still the same knee.
Yeah, also on that, when you say the knee that got injured in his 20s, it's healed not just because he did the physio and he did the thing and he did the other treatment and he strengthened, he did the rehab. It's healed because it's gone through its 4 stages of healing, which is very simple: inflammation, there's bleeding, inflammation, proliferation, and remodeling. That happens across time. That's why your typical ankle injury gets 6 weeks rehab. Grade 2 is maybe a bit more. Grade 3 is this. Ligament is this. Upper limb is this. Acute injury has a specific time span where the healing phase will start, move through its stages, and then finish. After that, there's no more injury. There's still a deficit in function, potentially, and that's very common. This is where the rehab needs to be really good. That's the remodeling phase, where you're realigning the scar tissue to restore the same function that the whatever tissue had. If it's a ligament, it's got to do proprioception and balance. If it's a muscle, it's got to be strong. If it's cartilage, it's got to be smooth and take the shock in the joint, etc., etc., etc. So when people have these old injuries, the pain that you're still feeling is not the stroke, unless you can point to, I banged it or I fell. 2 weeks ago I fell. And that's where people know, no, I rolled my ankle, I felt a pop, or it's the same ankle that I rolled, but I was playing football 3 weeks ago and this guy tackled me, you know. So yeah, it's the same ankle. That's a coincidence. Maybe it's not as robust from structural integrity because it's been deconditioning, because its function wasn't restored straight after the rehab back in your 20s. It was on a faster track to deterioration than the other ankle or the other joint, because it didn't get its nurturing. So it kind of, the nervous system started focusing on activating other structures in the area to develop the same function, blah, blah, blah. We can, the other thing with this is we can rationalize this. I can science this as well. I can, here's the pathway to why you as a 40-year-old, you got a sore hip because that you broke that left big toe and now you got a right hip because your gait. We can do these games all day. There's no way of knowing what the cause is, what the path is. But there's a lot of issues with the predictive mechanism sensitizing the nervous system. So with all that said, this is again, I want to hear what you have to say rather than me doing all the talking, but this is where what you're describing is what I briefly pushed past. Your cognitive stress takes you from a 5 to a 6, 6 to a 7. Why did you go into the pain aspect of this personality strength finder? If you could say something so powerful to a guy about his wife's personality and potentially save their marriage, do you know what I mean? Like you could be resolving an issue that may grow into a bigger issue. So why didn't you go into one of those domains? Why did you choose pain?
Just on this point, people ask, why do you do what you do? And I realized I don't do it for the person in pain. As much as I care about the client and they're in pain, I do it for the kids that live with that person, or the partner, or the employees that work for that person. Because I had back pain for 10 years and I look back on it now and there was nothing my husband could have done to help me, and I must have been miserable to live with. I used to lie on the floor just to decompress my spine, and it's all he could do was he's 6'4", so he'd pick me up and dangle me like to try and decompress my spine, which I can see now is absolutely ridiculous and wasn't going to help. So I do it for all the other people, but I think the reason I went into pain specifically, for a while I was coaching expatriates, and that was my niche, expatriates, and I would be talking to them about coaching them on whatever topic they would bring to the thing. And often it was things about marriage or about stress or whatever. And then halfway through the call, they'd be like this, and they'd be like doing something with their shoulder. And I'd be like, what's going on with your shoulder? I've just had this pain for like 8 years. And so then I started thinking, there's no coincidence that all these clients that are coming to me with all these emotional issues also have neck pain, migraines, back pain, and because I managed to get rid of 10 years of back pain in about 3 months once I understood the science and once I understood how my personality was driving a lot of the pain. And so it just made logical sense to pivot. And then I was on the brink of pivoting, and then it got to COVID, and at the time I was living in Sri Lanka, and we went onto a red list, which means the borders are closed. We couldn't leave even if we wanted to. And my eye started twitching like crazy. Like no one else could see my eye twitching, but I could feel it. And I thought, I know my eye is twitching because of stress, but I have a choice now. I can start Googling, like, what is wrong with, why have I got a twitchy eye? I can go to a doctor, I can get medication, whatever. Or I can just acknowledge, like, this is stress. And I thought to myself, if my eye's twitching and I know all of this about chronic pain, what's happening to the rest of the world right now in the middle of COVID? Anybody that was already at the brink of, like, those years of responsibility, people who already had so much on their plate and now they've got COVID, if they haven't already got physical symptoms, they will have them soon. And I thought, this is what I have to do. So that's why.
So, okay, so had you already got the right qualification or the appropriate qualifications in the pain realm, or did you go further down pain specific science?
Yeah, the very first thing I got trained on, I was a HR director. So after that, during that, I got trained in Gallup as a person that can facilitate that. And then I realized it's just a tool. Like I've got a coaching tool, but I didn't have the coaching skills. So I went through the ICF coach training to a pretty high level, and then
What's the ICF?
ICF's like the golden stamp of coaching. You know,
Okay.
like anyone can say they're a coach,
right.
but
Yeah,
this is
it.
like the for anyone that knows coaching, ICF is like what corporates would look for to make sure you actually are a trained coach. And then I got trained with SERPA in the UK, and SERPA is the UK kind of body for the mind-body pain. That training was absolutely excellent. And then, because I just love learning is one of my strengths. So I also got trained with Alan Gordon in the States on pain reprocessing therapy. So what I do is I bring together all the different, the best of all of the different things, and I've kind of created my own thing that I know works. Yeah, and so I've just taken a bit from here, and it's yeah.
So what does the consultation look like then? Someone tells you, listen, I've tried everything, my back is really sore, I need you to help me. What's the first thing I need to do? So
the very first thing is I have a quiz on my website. It's called Is Your Pain Curable? And it basically talks them through indicators of what could suggest that their physical symptoms might be more of a mind-body, or I call it at least neural pathway pain. And the questions are things like, do you have the following personality traits? And it's listed in layman terms, not Gallup terms. It's like, are you a perfectionist? Are you an overthinker? And so on and so on. And then there's questions about your past. Have any of these things happened in your past? And then there's questions about your physical symptoms. Does it come and go? Is it worse in the morning or at night? And basically all the questions are yes, no questions. And the more you answer yes, the more likely it is that you have neural pathway pain. If at the end of that, someone's like, nope, mine is definitely structural, fine. it's not going to work. But most people go through that, and by the end they're like, okay, I'm starting to, like, I can see now the correlation. And then I'll do a discovery call to see, because I'll only work with someone if I'm really certain I can help them. You know, I'm not, if I don't think that we can move the needle at all, I'm not going to waste their time. So in like 20, 30 minutes, we'll have like a chat, see where they're at. And then I do 6 sessions with clients. And during those 6 sessions, we focus on a bit more education on the pain if they don't already understand it. But there's a lot of books and videos and things I send them beforehand. Then we work through past timelining, like from the day they were born until right now today. We just do a quick inventory of everything they have gone through, and we start to match their physical symptoms that they've had over the years together with what was going on at the time, and almost always they start to see correlations. Things that at the time they had migraines when they were a teenager, and then they look back and they're like, wow, actually I was dealing with a lot at that time. And then we work through personality. Everyone goes through Gallup Strengths, and we do that. And then they have homework after every session to put it into practice. And one of the key things is within the first maybe two sessions, after maybe the first or second session, they have to get back to doing what the thing is that they most miss. And it's helping them to get past the fear of that.
So how do you rule out if it is structural?
I am not a doctor, so if it's something where there's any doubt, then they would go to the doctor. To be honest, most people that have work with me, they've already been to numerous doctors, and they've been told, on the MRI scan it's showing this, and this, but it's not life-threatening. We wouldn't suggest surgery at this stage. And then the client is like, I want surgery, but the surgeon's like, no, you're not there yet. So it's not life-threatening, so there's no reason why they couldn't work with me.
Okay, so is there a system in place then to be able to highlight something that could be structural and needs to go down the physical assessment route potentially as well, yeah. But rather than being, if because there's a lot of gray areas obviously. Mm-hmm. So how what kind of system is there to cover that? Because I find it hard in the gym to figure out what's structural and what's in the nervous system. I can build a picture of your lifestyle through conversation, and we're edging this way, but also there might still be a bit of structure in there that we need to be careful of. And especially if I'm going to start moving them and stressing them and straining them and pushing them and physically bending, twisting, then asking the structures to move, I need to be very cautious. So I usually just go and take the feedback from the client. If there's an MRI, I'll check in on the MRI, but even still, it's just it might say there's something structural, and then we have to put that front and center, go, right, you do have a pars fracture of your spine, so we do have to be careful what we do, boom. Or you do have a bulging disc. We don't know how much that's going to actually be causing the pain, so we're going to have to figure out the boundary of even the gray area and go from there. But how would you do that over a Zoom call? How would you separate that?
It's a good question. So one of the first things we do is evidence log. So an evidence log is where they will start to track themselves, their physical symptoms against emotional things that are happening. So whenever, let's say, the back pain comes on, what is going on for you right now? And very quickly, they can usually see a pattern between... I'll give you an example. There was a guy had back pain on the way to work, but didn't have back pain on the way home from work, sitting on the exact same car seat. That's a clear indication that it's not structural. Because if it was, it would hurt both on the way and on the way home from work. I've had clients where they'll get a skin rash the day before a big interview, for example. That's no coincidence. Mm-hmm. And the more you start to track it, the more obvious it is, because you just can't unsee the connection between the emotional and the physical. But if I was in any doubt, if they need to be 100% sure they're not going to do damage by doing work with me. But to be honest, it's hard to do damage when you're on Zoom, because I'm not asking them to move in any way like you are. But there are certain places in Dubai that I would recommend them to visit, physios, osteopaths. There's not many, to be honest, that I would trust, that would give an honest assessment and not scare the patient further. If they're a client globally, I will point them towards a website where there is doctors who are trained in what I do, but also they're doctors. And they'll do one consultation with them, and they'll go, yep, it looks like it is neural pathway pain. There is no issue with you working with Gemma.
Okay, cool. So then, do you have, that's the international side? Do you have those doctors here in Dubai? Like, do you have a network of that?
I know who I trust.
Yeah, and you got communication like with them. That's good.
I give you an example. I won't definitely say who it is, but there's an osteopath I spoke to here, and he said 75% of, I think it was 75%, it was a very high number, of my clients, I would say, have neural pathway pain, and they keep coming time and time again because it makes them feel better after they've been, because physically he's loosening them up, but they keep coming back. And he said, I've got a waiting list of people, and they have nowhere else to go. So now, like, he would refer, there's certain people that he would refer to me because he knows structurally he's done everything he can, you know.
And then is there anything, so that's kind of, that it's not at the lower end of the scale, but that's at the structural end of the scale. But is there anything at the severe, sinister end of the scale where you're like, you know what, you need to go see a, you know, maybe not structural, but a psychiatrist or a real, like, maybe this is central pain issues where we need to get you and a brain neuro doctor, call it what you want. Do you know what I'm trying to say? Like centralized, I'm going blank on the word, but like centralized nociceptive, what is it called? Where the brain is now just manifesting pain from the neuroplasticity perspective, not from like a thinking perspective.
I don't know if I've had anyone like that, but I think, to be honest, you can tell.
It's called centralized. Oh my God, I'm going. So I spoke to. Anyway,
yeah,
carry on. I'm not going to think of it.
Clients can usually tell, even after the discovery call. Oftentimes, they just in your gut feeling, you know that this is the right approach, and they almost immediately have this like sense of relief, like. And the symptom, I've had people do discovery calls, and after the discovery call, their pain is gone, literally.
Yeah. I mean, I don't do the same way you do, but I can see when I'm talking the little spiel I gave a few minutes ago about, like, here's the thing, I'll draw it out on a picture, I'll do little scribbles, and I'll go, this is what we're talking about, here's your thing. I'll show them some images, Google images that help me explain the anatomy of the brain and the thing called the homunculus, blah blah blah. And I can see their wheels turning in their head, and I can actually see their eyes glazing over with water, which I know is a sympathetic response. Right now, I'm stressing them. They're thinking hard, and they're connecting the dots. And I actually don't want to know the psychological side of it because I don't have any skills to, like you do, to help them with that. But at one point I had one lady in the middle of this. She just said, "Yeah, I think my husband's cheating on me."
Yeah.
And I was just like, "Okay, I mean, that's definitely something that's going to stress you. So that's going to shift you. Like, I can't deal with that. Thank you for telling me that, but it's not relevant to me and what we need to do. But I suppose it could be, but I don't think it's often relevant to what's going on in your the model is called the biopsychosocial model. So what's going on in your social world is not really too important here. As long as you're not a raging alcoholic as a result, as long as you're not able to show up on time and do the work, then it doesn't really affect it. We can talk about it, but they're connecting the dots and they're going, yes, that's stressful. That's okay. I do actually see, wow. So there is something else here going on. And after that, then I'm only in the movement realm. That's often not enough. Do you know what I mean? And I've had failed situations where one guy comes to me because another guy has referred him. They've got the exact same symptoms. They both actually work in the same job. He doesn't quite come as often as the previous guy who enjoyed massive success, but the physical is just not working for him. Do you know what I mean? We're doing a bit. It's getting a bit better. Yeah, it's getting a bit better. And he's trying to be positive. He's trying to stay. It's just not working. And I know that what's going to happen is when he goes away on his summer leave, his Christmas leave, he's not going to come back. You know? That's his little timestamp where, you know what, I wasn't really working the gym. I'm just stuck with this back pain, do you know? Whereas they'll need somebody like you, like, listen, talk it out, figure it out, unpack what is shifting you sympathetic day after day after day, because I'm only pulling one small lever here in the movement realm, and the capacity and the fatigue and the strength.
It's interesting though. I've obviously got no idea who you're talking about, but I'm imagining this guy. It's easy for someone to go to the gym because it's like physical, like there's no, it's logical, it makes sense. I'm going to go to the gym, I'm going to strengthen my back, and and the pain will go. I tend to pick that client up, for example, a year from now when he's absolutely desperate.
Mm-hmm.
And I wish that they could come earlier, but it's just, it doesn't somehow seem that it would work, yet it does, time and time again.
Yeah. No, look, I get it. And when we spoke a few weeks ago, I was like, yeah, this is, and you've probably got more capacity because you can work in just a conversational setting, so you can do it online, you can do it casually. I need someone to be brave enough and courageous enough to come into a gym, be vulnerable, hand their physical, like body metaphorically, over to me and go, all right, let's start, let's have a go at this.
But you know, it's interesting about the woman that said about her partner, even just her saying it out loud and hearing her voice hit the air with you, it's like a safe space, that would have helped enormously, even if it doesn't solve the problem for the marriage. But sometimes people will say, you know, do I need to leave my job to get rid of my back pain? Do I need to leave my partner to get rid of my back pain? And you don't. Like, you just need to acknowledge that, like, this is a stressful situation and my physical pain doesn't need to be linked to that. Like you're saying, it's like the repetition of doing the movement without being scared of the pain.
So taking that example you mentioned earlier about the gentleman who you said to him, look, your wife is not whatever, it's just her way, she's not you. Like, how does that change him? How does he goes, okay, you're right, so what? You had the example.
Yeah, you mean, okay, so I'll give you a different example. I'll give you my example. So let's say, hypothetically, I'm cooking my husband dinner and it will go in front of him and he'll say something like, this would be even better if we had carrots with it. And, you know, I'm like, like, I'm triggered right then and there. Like, why can't you just be grateful that I've cooked you this dinner, right? But now I happen to know that my husband has a strength called maximizer, which means he will take a situation or a person or anything that's great and he will want to maximize it. He will always put the icing on the cake of every single thing. So it doesn't matter how good the meal is that I give him, he will always have a way to maximize it. So that used to be a massive frustration because I would, is it not good enough? Like, whatever. Now, when I do it, I just laugh and I'm like, look, this is Daddy's maximizer. He's maximizing the dinner.
So you're just reframing things.
Yeah. And you look at when you understand that you have these strengths, you automatically start looking at others, realizing that they have their strengths and they are different to you. So I came head to head a few times with finance when I was in my HR days. And whilst I'm all about action, moving forward, achieving things, finishing, finance is quite the opposite. Finance is about controlling the numbers, analytical, asking lots and lots of questions. That used to be a huge, huge trigger for me. But the minute I realized that finance person had these strengths, now I would go there expecting she's going to ask at least 10 questions. She's going to want to take her time. So I'd go, can you approve this? I'm going to give it you today. Let's talk about it tomorrow. So I'm talking in their language rather than my language. Does that make sense? Yeah. But you just see the world through these different eyes.
Well, you're organizing the world. You're going back to what you used to do as a kid. In this instance, you're going back to reorganizing things. So now I can put you finance people in this box. I can put my husband in this box. Yeah. But what about the people you don't know? What about, like, I don't know, who are these people who are just annoying me right now? I've never met them before and I'm really triggered. And then my back hurts.
I love this
question. Is everything just a I need to stop and figure out where this cloud has a silver lining?
Can you give me an example of somebody that really annoys you? Don't say their name, obviously.
I try not to. Let me think. I definitely can. Do you want me to? What do you want me to do?
Like, how would you describe this annoying person?
It's more, God, people call me grumpy all the time, so I should be able to come up with like a whole long list of.
How do you feel about people who are like Pollyanna positive? If you're grumpy.
I don't think I'm grumpy. I have moments of being like short and like Okay, but to be honest, what you're describing is something that I actually do work on a lot myself. If you had asked me this 7 or 8 years ago, I could have spat out a long list of people.
Okay.
But this is something that I have been working on, not from a pain perspective, but just from I try and live in this world of, if I'm getting triggered by something, there's something here that I don't understand. There's elements of this pie or this puzzle that I don't understand. So my triggering comes from the assumption I've made about this situation.
Yeah.
And that's more often than not, it's wrong.
Yeah.
And it also doesn't serve me to jump to that conclusion. So what I need to do is figure out more information. And usually more information strikes me in the understanding. Oh, now I understand. Okay, I understand what led you to make the decision that you made to then for that to happen.
Yeah.
You know.
Okay.
So by asking, that's been my, and I suppose as a result that allows me reframe the thing that just happened. But I'm trying to get actual info to be in the new frame.
Yeah. So this is great that you've done this. And I can give you an example. I'll give you a couple of examples of different people that might irritate different people. So from a strengths point of view, there's one called positivity, which means people who have positivity strength they always see the glass half full. They may be a bit overly ambitiously positive about absolutely everything, even in a negative situation. Oh, but it's blah, blah, blah. They'll be positiving it up. But then there's a strength called restorative. And people with restorative are really good at finding problems. They can find problems when there are no problems to find, which is an amazing strength if you work in a place that requires you to find product defects or risk assessment, this type of thing. But of course, you don't turn your strengths on and off as and when you go in and out of work. You're the same person on weekends and evenings and all the time. So if you have two people in a family, let's say, one that's positive, got positivity, and one that's got restorative, they will never see eye to eye, because you'll be like, why are you so positive? Why are you so negative? And it would be, there'll be constant conflict. Another one I see oftentimes, actually this used to be one of my big triggers I never used to be able to stand it in a meeting when somebody said nothing at all. They would sit in silence for the whole meeting, or you'd ask them a question and they would take ages and ages and ages to give an answer. And now I have a strength called activator, which means I am so fast that I will speak before I think, and I'll sometimes say something and I'll later regret it. And then there's deliberative strength, which is really, really careful thinkers that are such careful thinkers that if and when they do say something, it is so profound and it is so amazing. Like, you need that person to be in a meeting, but to expect them to talk constantly through the meeting, it's never going to happen. So can you imagine that deliberative person, how much they must have been triggered by me?
Yeah, but I'm also thinking about the person who's careful because they're worried about what they're going to say for all other reasons of they're going to look stupid, they're going to, they're afraid of saying the wrong thing. So by that pathway, they are careful. And then when they speak, it's not profound. Yeah. It's like, oh, you did say the wrong thing. You should, not that you were like, because there is those people. I know that the type of person. Why would you get triggered by somebody who's sitting quietly in a meeting?
Well, I'm thinking when I was much, much, much younger, but I not triggered, but I would think, why are they there? They haven't got anything to contribute. Why do I have to come up with all the ideas? Obviously I'm not like that now, but when I was in first leadership roles, we want people to be like we are, because we think our way is the right way. So at one point, I thought everyone was lazy. But why did I think everyone was lazy? It's because I have achiever. So I'm working like 10 times faster than everyone else. But that's because that is my specific strength. I now realize, like, the world is not lazy. It's just I was in overdrive with one of my strengths. Does that make sense?
Yeah, I mean, like, you go back, like... I don't know why people would call me grumpy, which we've touched on, but I don't know what my strengths are in this sense, but perhaps I should take this what did you call it, Gallup?
Gallup strengths, yeah.
And we'll see. I don't struggle with pain, but there's definitely other stuff I need to work on. But I'm still kind of interested as to how it is how you went down the pain pathway route with this. Because with this Gallup thing, I'm imagining that like other people don't know. I don't even know more than the strengths you've said, these 34 strengths. So do I have to learn all the strengths to then start identifying in people so that I can understand who you are, so I don't get stressed being the outcome of this pain pattern causes pain? Like how do you teach people you're gonna get pissed off, try not get pissed off, and then your pain won't happen?
Do you know there's a tool that, like I don't know what you call it, a tool or something that helps me enormously is there's expectation and then there's the outcome. So the expectation that this person will be friendly and kind and helpful, but the reality or the actual outcome is probably not going to be close to that. And what I find a lot of the stress trigger comes from people having very high expectations of people and of situations. I have an expectation I will be able to drive to this podcast on time today, because I deserve to get here in 10 minutes because that's what SatNav says. And then halfway here, there's a traffic jam. And the old version of me would have been furious. But now I'm just like,
It's interesting you use that example of expectation, because that's the example I would give about understanding. So you have an expectation taking traffic. You have an expectation of when you go out on the road, you're going to get there in 10 minutes. And now all of a sudden there's traffic. Well, why is there traffic? Do you know? When you understand why there's traffic, because let me say it another way, the only way to get people, I believe, to switch off angry, negative, frustrated feelings, you can't take a pill, you can't eat a food, you can't practice anything mentally that will literally switch that feeling off as quick as understanding does. Do you know? Yeah. So you're angry, why did you do that? If someone gives you a very honest explanation of why this happened, it doesn't happen all the time, because sometimes it's even more frustrating when that, but it has, that understanding has got the potential to just go zoom, and I see. And the example is expectation, traffic. You get cut off. You know, it's this. I don't know where this example came from. You get cut off you get frustrated. Who do you think you are? And all of a sudden you learn that person's on the way to the hospital because there's an absolute life critical emergency. Well, most of the time you'll go, oh, okay, go ahead. Do you know? And the understanding just switches that off. And it's the expectation versus the outcome.
Yeah, although with this example, you're relying on external answers. So it is possible to feel frustrated and turn it off yourself without having the answers. Just by almost acknowledging that word, I am noticing that I am feeling frustrated, and then breathe. You know, and just, it's okay to have a feeling like that. And once you can identify the emotion, it lessens it almost, instantly. And obviously breathing is super powerful. But I think control is another thing I see in almost every single client with pain. They want to be able to control life and the traffic and the relationships and absolutely everything. But the truth is, we cannot control anything. Yeah. And that seems like a big piece of the puzzle for people.
So how do you educate that?
Well, again, the expectation versus the actual reality. Like I give you an example. My car broke down. Actually, it literally broke down outside here not that long ago, and it went to the garage, and I was so angry that I had to pay so much money for the car. And then I was like, hang on a minute, I didn't think it was fair that my car broke down. And then I realized, well, of course it's going to break down. It's a car. Cars break down. That's just what happens. But in my brain, for a minute there, I was thinking that like my car should be different to everyone else's car. My car should never break down. Do you see what I mean? Yeah. So in my head, I'd been trying to control the outcome, and you just can't. Even like it's in the garage, how much is it going to cost? I could worry about it for a week, or I could just wait until they tell me how much it's going to cost. The same outcome.
Yeah, I mean it is the I suppose the power of reframing. That is the ultimate trick, isn't it? That's
But let's say the car's in the garage for 5 days. During those 5 days, my old brain would have been overthinking, obsessing. What if it is this much money? What if it is that much money? If it's this much, then I'm going to do that. If it's that much, I'm going to do that. That is a trigger for back pain. For me, it was. Whereas now, because I know I don't want the back pain, I know I need to focus on not thinking about all these different outcomes. Just wait.
Yeah, patience is the virtue, isn't it? I mean, that's the nervous system being calm, and that's the ultimate to stay calm, to stay relaxed, to stay happy. If you can figure that out, and then
you've made it.
Yeah, by the time that happens, probably you've not got many years left in you. But on a more positive note, where can people follow you, get in touch with you if they're interested in what we've talked about?
So my website's my name, GemmaMcFall.com. And I'm on Instagram, LinkedIn, Facebook.
Same name, the whole lot?
Yeah, no one else has my name. It's Gemma with a G.
Same with me, but people still, sometimes that's a bad thing.
Yeah.
All right, well, so at Gemma McFall on all of those.
Yep.
Cool. All right, well, thank you for coming down, and good luck with helping people think their way out of pain.
Thank you. Thanks for having me.